Hi everyone, today I will present a forensic pathology overview of ruptured berry aneurysm. So a berry aneurysm is a thin-walled circular outpunching of a cerebral artery. It is a critical diagnosis because it causes 80 to 85% of non-traumatic subarachnoid hemorrhage. This aneurysm developed at the high-stress vascular junction in the circle of Willis, and as you can see, the most common site is the anterior communicating artery, roughly 40%, followed by the middle cerebral artery and internal carotid artery. So this gross specimen photo clearly illustrates the berry-like setted balloon out of the vascular tube before it ruptured. So next, the postmortem finding. On gross examination, the hallmark is extensive subarachnoid hemorrhage. The massive blood accumulation will occur the base of the brain. Because the intense pressure, the brain will become swollen, resulting in flattened gyrate and narrowed suicide. Microscopically, we look for why the vessel failed. So this low power slide shows the fatal defect. The aneurysm wall is completely missing its strong structural layer, which is the tunica media, the muscle layer, and the internal elastic lamina. So the wall is just thin with fibrous tissue that is highly prone to bursting. Systematically, we look for the trigger, find the causes. In these autopsy cases, we frequently find the evidence of chronic hypertension. So this included an enlarged hypertrophic heart and scarred kidney, known as the nephrosclerosis. Okay. Radiological imaging is also the key for our clinical diagnosis. So a non-contrast CT scan is the first line tool. Here, you can see the appearance like the star of death. The bright white area in the center are hyperdensity. So this confirms the acute blood filling basal system. And also the technique like the CT angiography and the digital subtraction angiography DSA are used to map the exact 3D size and location of the aneurysm. Okay. Now we move to the mechanism of death. So how does this pathology cause death? First, it begins with the rupture of the weakened aneurysm set. The arterial blood leaks directly into the subarachnoid space, causing a massive hemorrhage. Because the skull cannot expand, this added blood triggers a severe spike in intracranial pressure. So the pressure leads to cerebral compression, forcing the brain tissue downward. And these downward forces cause brain herniation. And the herniated brain tissue will directly compress the cardiorespiratory center in the brainstem, leading rapidly to death. So our final forensic causes of death will be the subarachnoid hemorrhage due to ruptured berry aneurysm. In a summary, a ruptured berry aneurysm is a lethal combination of microscopic wall defect and systemic blood pressure, resulting in a catastrophic brain herniation. Okay, that's all. Thank you for your time.